Now that you've had your procedure, these are the instructions that I would like you to follow to hopefully make your process of healing as fast and as smooth as possible. By far, the most important thing that you can do is to ice your eyelids and your surgical site for the first 48 hours. A lot of patients have told me that the easiest way to do this is to take frozen peas, and some people will even put the frozen peas into little Ziploc bags so they have a couple different ice packs. The key is you want to do this as often as you can. So if you can do it 20 minutes on, 10 minutes off, some people can only do it every half an hour or every hour. The key is though, the more you do it, the less it's going to bruise and swell. After 48 hours, it really doesn't matter. So you can either do warm compresses, cold compresses, or nothing. Whatever is most comfortable for you. The first night, if you can, please try to sleep with your head elevated, either propped up on two pillows or in a chair. You only have to do this for one night, and if you can't do it, it's actually not too much of a big deal. If we called in an ointment for you, you'll need to use that 4 times a day for 5 days. You really can't mess up the ointment. You only need to use a small amount along the incision line, and you can either apply it directly from the tube or with a Q-tip or with your clean, dry hands. So just apply a small amount of the ointment directly along the incision line. At night, if you put a little bit of that ointment directly onto the white of your eye, that will help keep your eyes lubricated at night. Just be aware that if the ointment gets in your eye, it's actually safe for your eyeball, it's made for the eyeball, but it will make your vision blurry, so don't be concerned about that. The other thing I recommend to patients to keep them comfortable is to use a drop like either Cystane Ultra or Refresh. You can use that drop up to 4 times a day, and it's over the counter, and this will help keep your eye lubricated. If you're using other prescription eye drops, it's okay to use Cystane Ultra. Just wait about 5 minutes in between the drops. The other thing that will help you bruise less and swell less is to take it easy for 5 days. So this includes anything like bending over, lifting heavy objects, exercising in particular, and working out. So anything that raises your heart rate, like even taking like a brisk walk, will make you bruise longer and swell a lot more. So try to take this time to take it easy, call some old friends, catch up on your reading, do some light errands, just anything that doesn't require exertion. Also, don't wear any dark makeup for the first 14 days after the procedure. Things like mascara and eyeliner in particular, anything dark will get underneath the incision line and pigment the incision line, and you have a tattoo. So you can wear cover up on the lower lids, especially if there's no incision there, after about 5 days. Some patients prefer something called Dermablend, which is really good for covering up really dark bruises. One thing that I don't want you to do is use vitamin E. Sometimes some doctors will recommend vitamin E on other parts of the body, but vitamin E on the eyelids and the eye will actually burn, and that will make it worse. So do not use vitamin E on the incision line. After 10 days, you can gently rub the incision line with a towel or just with your finger in the shower, and this will entice the stitches to fall out. Almost all the stitches that I use are dissolvable, so they will pretty much fall out by about the 10 to 30 day mark. If they're bothering you, I can remove them after about 5 to 7 days in the office. The other thing I'd like to remind you about is that it's common and expected to see like little bumps along the incision line. Those are totally normal and they always go away. Sometimes they do take 3 to 6 months to go away, but they always go away. If they're bothering you, I can inject them in the office. It takes about 2 minutes. You feel a little pinch and burn with a steroid, and that will make the bumps go away a lot quicker, but you do get a little bit bruised up afterwards. You can shower the day after the surgery, but just try not to get the shower going directly into your eyes. And when you're drying yourself off, you can blot dry, but just make sure not to rub anything around your eyelids or the surgical site. To prevent pain, I typically recommend to all my patients that starting the day of the surgery when you get home, you should be taking Tylenol every 4 to 6 hours. If you take the Tylenol consistently, starting from the get-go, you'll be ahead of the pain and it won't really develop, and you'll feel comfortable the whole way through. Most of my patients come back afterwards and they say that they stopped the Tylenol after about a day or two. But you do want to kind of be ahead of it, especially on that first day. And maybe if you don't want to take Tylenol, at least take it right before you go to sleep. Tylenol will work better though than baby aspirin, Advil, Motrin, ibuprofen, Aleve, and naproxen. All those other pain medications other than Tylenol will make you bleed and bruise a lot more. I've actually never had to call in any narcotics or any more powerful pain medications. So if you're having such severe pain, then you need to call me because I would like to make sure that nothing else is going on. If your doctor or cardiologist prescribed to you baby aspirin, Coumadin, warfarin, Plavix, Xarelto, Eliquis, or Pradaxa, or any other blood thinner, then talk to that doctor who prescribed the medication as far as when to resume it. If they defer the question back to me, I'll typically tell you to resume it the next day after the surgery, but make sure to talk to me and ask me specifically if you have any questions about that. If you ask me, I always go back to the doctor who prescribed it though. As far as contact lenses, you can wear contact lenses as soon as you feel comfortable with it, but try not to pull on your eyelid or the surgical site for the first couple days after the surgery. There's a couple things that are normal and you should expect them, and so I just want to kind of put them out there so that you know not to get alarmed if they happen. The most important thing that kind of alarms people that's normal is that the main bruising and the swelling typically happens over the course of the few days after surgery, and so it's usually the worst over the weekend, and probably by about Monday or Tuesday will be the peak, and then after that it will start to subside. It's also normal for it to always bruise underneath, and then one side always bruises more than the other side, and the corollary to that is that one side will always heal a little bit quicker than the other side. I also make the sutures a little bit loose because if I make them loose, it's normal to see a little bit of blood or discharge coming from the incision lines the first 1 to 3 days afterwards. But the nice thing about that is that the blood isn't stuck on the inside and doesn't cause as much bruising and swelling. So it's normal to have a little bit of discharge for those first 3 days. Over the course of the 2 weeks, you'll start to notice that the incisions will start to look a little bit pink, lumpy, and bumpy, and that's totally normal, and that always, like I said, will start to subside. Usually by the 6-week mark, but the bumps always go away by the 3 to 6 month mark. And then lastly, it's totally normal, even if we're just doing surgery on your upper lids, for your cheeks and your lower lids to get blue, black, purple, yellow, all sorts of fun different colors. So don't worry about that also. Please don't hesitate to call me if you're having any kind of problem or any concern because we are here to help you. During the day, the best way to get in touch with us is to call the office, which is 201-696-2646. And then after hours, my cell phone number is 347-556-2100. You should definitely call me if you're having any kind of severe pain, if you're noticing that you're having a loss of vision, or that you're having a sudden increase in redness or really heavy bleeding. Also call me if you're having any kind of fever or unusual discharge from the site, although I wouldn't expect that. Lastly, thank you again for entrusting my staff and me with your eye care. We take this responsibility extremely seriously, and we really do take pride in the fact that you chose us to be partners with you in improving your health and your quality of life. So if you have any questions, please feel free to call our office anytime. We're really here to help you, and we hope this process goes as easily as possible for you. And I look forward to helping you, and I wish you a very quick and comfortable and speedy recovery. Thank you so much.